Maybe we could start with how old are you?
I'm 39 years old.
All right. And basically, I met you in November of 2011, and at that time you had had 3 years of bad vertigo, and you were told it was a vestibular neuronitis or possibly Meniere's.
Correct.
Very sudden onset.
Yes, immediate.
Yeah, and you got very sick to your stomach, and you were hospitalized for chest pain and dizziness. And then you eventually saw Dr. Timothy Hain, who's a terrific vestibular doctor, and his partner, and they really, confirmed that you had an inner ear problem, but the treatment was less than dramatic for you. You continue to have dizziness, and tell me, you actually missed work for a year?
A year.
Because what happened? You would just get too queasy?
It just never, the dizziness never stopped.
So we're talking about 2008 to 2009, you could not work.
Correct. The first 4 months were more, I was bedridden. Yeah,
And then what did you do in terms of treatment?
well, the first doctor I saw treated it, looked inside the ear, then I went to a physical therapist, then I went to an ENT, then I went to my uncle, another doctor, and then I ended up in the dizziness with Dr. Hain. And
Right.
treatment was, there were different types of medication.
Yeah, he would try various
He
things.
tried, but they were so potent, and I didn't respond well with them.
And then were you just left on Valium?
Correct. My uncle still felt like it seemed more to be many years. And
Uh-huh.
it did help. It did help.
To be on Valium.
Yeah.
Were you on that for very long?
Yes, until I saw you.
Oh, well, that's a couple of years of that. And I remember that you had trouble, you could be activated in terms of your dizziness very easily. What type of things would bring your dizziness on?
Visual movement, the quick visual movement. The first time I realized that had something that would start the dizziness was when I was driving in a car and a storm happened real fast, so I turned on the windshield wipers fast, and immediately I vomited.
Really?
And then I told my doctor, because then that was like a clue, like there we go, that's what's causing the dizziness. And then scrolling on the computer would set it off. I felt like my eye would shake, like the nystagmus. They did find a nystagmus, but it was subtle.
Uh-huh.
But I'd feel my eye drop, like stop, and then my eyes feel like they're falling.
Right.
If that makes sense.
Yeah, and I think also if you watch your kids play soccer, if it was a windy day and you started getting...
Oh, the wind. That's right, you reminded me. I couldn't be out there in the wind because yeah.
Did you ever even think of going on a boat?
It felt like I was I was constantly dizzy, like I couldn't get off the ride.
And you had probably tried all the antihistamines like meclizine and Dramamine and
Yes,
Benadryl.
I still have Dramamine in my purse just in case, because it doesn't really work, but it's such a horrible feeling.
Yeah.
So.
And during that 3 years, would you say you would have, during the day, at least once or several times a day, you'd get that feeling? Or did you get long periods of relief and just get episodes? Or?
What it would do is it would subside, but it never went away. That year, it was terrible.
But from 2009 to 2011 till I saw you, how frequently would it be? Anytime you turn the windshield wipers on, or you had to be stimulated by something?
After that, yeah, the year before I saw you, it was more of a visual stimulation that needed to occur, or the soccer games, the wind. The first year was just consistently, it seemed like it was always there. The year before I saw you, I could live with it. I don't know whether it went away. Obviously, I think it's still here at times.
Yeah.
But, it just would have to be caused by either the
It's constant though.
What was
It still was constant.
oh, it was,
She
it was
used to call me
consistent.
almost every day, crying.
Yeah, that's her aunt calling, who said
Sorry.
that she got a lot of phone calls crying that you basically had it every day.
I didn't want anyone to know because it was
Yeah.
such a long thing, and you don't want people to feel bad for you, so I just make her feel bad for me.
And everybody else felt you were fine, and your aunt had to hear how you weren't fine.
The truth.
Now,
Or even I remember once being at a funeral and all the people in the room,
moving.
movement, and so, but if I'd lean against the wall, it was better.
So you'd have to steady yourself.
Supermarkets, the colors, That's, I actually had a little, that's when I knew it was coming, yeah.
Yeah, that would set it off. And any time on the direct TV, those menus flashing by.
Yes.
What would you have to not look at them?
Yeah, I'd look away.
And could you actually use the computer much, or were you?
It started getting bad before I came to see you.
So you having trouble doing that?
Yeah.
Did it affect your work at that time?
Yes.
How did it affect it?
The lighting in the front office at my dad's dental office where I worked, when it would go out, I think it was, what kind of lighting was it?
Oh, kind of
You know,
fluorescent.
Fluorescent, and sometimes it buzzes. I couldn't sit up there with the way that the light would kind of, I could sense it.
Yeah.
Like my body could feel it.
And you'd start
Some
feeling.
people couldn't see it, but it's like I knew something was wrong with the lights. I could almost know it was blinking.
And
No
you started getting
frequency.
dizzy.
Yes.
Now, when I saw you on 11/1, then I injected you, and we made you lie on your side for a few minutes. And when we were done testing you, we tested you for the nystagmus, and it was gone. And I think you felt quite a bit better
Yes.
at that point. Yeah, you were on your side for 12 minutes, and you sat up, and you could tell something was different.
Correct. I felt, I don't know how to describe it. I felt like there was a literally though, there was pressure that subsided
Yeah.
in
And
my
then,
side of my head.
then a month later, I think you said, well, you were about 85, 95% better, but we said, let's treat the other side, and we did.
Yes.
And now it's, a couple years, well, 2011 to 2014. So how much dizziness have you had since December of 2011 to December of 2014?
50.
15, well, now
Not
it's,
yet.
yeah, not quite.
It subsided. There were only I really didn't have very many episodes.
And you can do most anything you want.
Yes.
Very
And
good.
just real quickly, after you treated me, we went to the computer screen and I immediately scrolled, and I was very afraid to do it. You encouraged me, and I scrolled. And then we went into the car and turned on the windshield wipers.
That's right. We're
And
not
I could keep
afraid.
my eyes open.
We're not afraid here to actually test what
No.
happens. And that's how fast it worked. You left
That
here.
immediately.
Yeah, she was hoping it was going to rain on the way home so she could just have her wipers on. Well, very good. Well, I'm glad we captured that story.
That's a good story.